And welcome back to Hannity. So an image of Hillary Clinton recently posted to the website The American Mirror is sparking new controversy for the Clinton campaign. Now, the picture, which shows Hillary Clinton apparently needing assistance to climb a flight of stairs at a campaign stop back in February, was picked up by the Drudge Report, which posted this headline over the weekend, detailing Hillary Clinton's history with falls and speculating that the former Secretary of State could be experiencing a serious undisclosed medical condition. Earlier today, we reached out to the Clinton campaign for a statement, and a spokesman told us that the Drudge Report is shameful, and anyone who buys into that vitriol, including yours truly, is shameful as well. So shameful we are. Anyway, but what was noticeably missing from the statement was any reference or rebuttal to the health issues that are alleged by Drudge and others. Joining us now with analysis from the Fox News Medical A team, we have Fox News medical correspondent Dr. Mark Siegel, and Dr. David Samadi is with us. All right. It's in the Daily Mail, are Hillary's health problems more severe than thought? A new book is coming out that claims that. The Gateway Pundit had today Hillary's handler carrying a diazepam pen for patients who experience recurrent seizures. When you look at her history, Dr. Siegel, of falling, concussions, the blood clots, etc., and then this other video that has emerged, what are your thoughts?
I think the public has a right to know. Number one, we're talking in 2008, Sean. I looked over 1,000 pages of John McCain's records because of a melanoma he had had 10 years before. What about Hillary? 2009, a severe fall. She breaks an elbow. 2011, she boards a plane, falls. 2012, she has a severe concussion, which Bill Clinton says it took her 6 months to recover from. Then she ends up with a blood clot on the brain. She's on lifetime blood thinners. Just the point alone, if she's prone to falling, and you see from our picture up there that it looks like she can barely get upstairs without two people carrying her. Guess what? If she falls and hits her head, she'll get a blood clot on her brain. What did you think? Just
out of fairness, I don't want to show the video, but I've asked both of you to look at the video where she seems to, like, some have said it's like a mini seizure. What does it look like to you?
It looks to me, I'm also concerned about this concussion she had in 2012. It could be a post-concussion syndrome. You know, your balance is off, you're dizzy all the time, your memory is off, you're not thinking clearly. Maybe that's what she meant this week when she talked about that glitch she had with Chris Wallace. Maybe she just can't
When
think.
she says she's short-circuited.
Right.
Also, it's not just that. She doesn't give a lot of press conferences. She doesn't want to seem to put herself in high-pressure situations.
I want to know what her neurologist says. I've reached out to her neurologist at Columbia after she had that fall, no comment. I want to know what her neurological records show.
And you think, as you have done this with John McCain and other presidential candidates, obviously John McCain is older, you think it's fair game, especially if people see that some things seem a little off.
Not just fair game, just the point alone that she's on blood thinners and seems to be prone.
Why would you need blood thinners?
When she's in the White
Is there a
House?
possibility she had a mini stroke, a TIA?
Absolutely.
What do you think, Doctor? You believe that?
Well, you know, the picture that you showed as she's going up the stairs speaks a million words. So is she really fatigued? Is she dehydrated? One of the main reasons why she fell in 2012 and had the concussion was severe dehydration. They're holding her and going up the stairs, so she may be really dehydrated. She may have arthritis. She may have back pain. She may have fallen again that we don't know. So there are a lot more questions that's unanswered. What we know today is that she is on thyroid medications. She suffers from hypothyroid or low thyroid that can cause some fatigueness and gaining weight and all of that.
What about this photo that the Gateway Pundit had up today, Jim Hoft, in an article, and, you know, Hillary's handler, I guess, caught with a diazepam pen? What would that be for?
So one of the things that happens after having concussion, usually within a year or so, you should all the symptoms should resolve. Occasionally you have a latent or delayed kind of post-concussion syndromes, and seizure
sort of like
is one of those.
traumatic head issues for a football player.
Exactly what it is. And that can come years down the road. She may have some of these symptoms.
You think that's what you're seeing?
Well, I certainly think that a traumatic brain injury with symptoms down the road is very, very likely here, especially since she had a blood clot on her brain. And as David was mentioning, that can actually lead to a seizure problem. Someone's carrying a pen that you would use in the case of a seizure, a Valium pen. That makes me wonder about that. We need to see her records to see what's the sequelae.
Well, they want Donald Trump's tax. There's two things we want from her. We want her speeches to Wall Street and the medical records in full.
In full. I mean, Donald Trump eating fast food is nothing compared to this. Bill Clinton ate fast food in the White House. President Bush told me in the White House he couldn't stay away from the pastry chef.
Well, the other thing.
And look at him now.
All right, I got a break, but all right. So something to follow. People should pay attention. All right, thank you both. Coming up, very important.